Alright, so today I just wanted to talk a little bit about short-term care and why you need to talk about it with your clients and how we can bring in some more data to just talk and to be more, I guess, convincing for those people who are more analytical. For people who understand that this is something necessary, that long-term care is necessary, they won't need to see much of this presentation. But for people who are more, thinking about probability and your analytical type clients are going to be what uh, can help you in helping them make a decision or at least come to terms with what the risks are. So Medicare actually suggests that, well, they don't suggest it saying you should buy long-term care, but at least they say at least 70% of people who are Medicare age 65 and older will need long-term care support and services, and that Medicare and Medigap don't pay for any of this because it's called custodial care. So it's important to plan for this, and long-term care insurance is the best way to do so. So normally when we think about insurance, we think about catastrophic loss. We have home insurance, we think about, okay, a house fire. Then car insurance, we think about, wrecking a car and replacing our car. Medical insurance, we think about the cost of hospital, cost of surgery, cost of, um, you know, cancer. For life insurance, we think, okay, my family is going to need income that I no longer will provide because I'm past. I need life insurance, right? But these are the odds of those things happening. 1 in 1200 for a house fire, 5 in 1200 for a automobile, and 105 in every 1200 for hospitalization. What about long-term care? 70% is here. So all these red dots are when it's covered, or the odds of needing long-term care. And is this risk covered now? And most times it's not. And needing extended care is the number one reason for seniors to be bankrupt after the age of 65. And the reason is most people aren't thinking about it. It's depressing. We often make assumptions based on the past. We've never had a long-term care exposure or experience, or and we just don't have to worry about it. That never happened before, right? And there's also no discussion, so there's no plan, and also it's expensive. There's no commercials, and the reason is because it's too expensive even for the insurance companies. 70% of people are going to require this kind of care. That's not the kind of risk that insurance companies are willing to take. And also, it's not a risk, or it's not I guess you could call a line of business that they can afford spending, millions of dollars in ads. They have to spend those millions of dollars insuring and paying for claims for their clients. There's less than 14 companies nationally who do this. There used to be hundreds, right? But not anymore. So Bankers has a product that can cover for short-term care, while long-term care is important. Long-term care can be cost prohibitive. And, Bankers, as well as us here at Plan Advisors, we have mostly senior clients. And all of these clients, 70% of them, could need long-term care. So we should be having these discussions. We should be talking about it. With COVID-19 and the kind of exposure that we had to COVID-19 and facilities, we kind of have to be more cognitive and be more aware of, how we're going to pay for this kind of care and where we want this kind of care. So what are the costs? Now, these are national averages. In Hawaii, they're going to be more expensive, obviously, but in-home care is usually $40 to $75 an hour. The average is 3 hours a day, so we're looking at anywhere between $120 to $225 per day. An assisted living facility is anywhere between $4,000 to $6,000 a month. And nursing home is $6,000 to $10,000 a month. Kind of expensive. So, what have we discovered about this type of care? So about 60% need care for less than a year, and about 80% need this kind of care for less than 2 years. So the basic, the need that we really need to cover the most, I guess the highest or the most risk or most common circumstance is 1 year or less and 2 years or less. So we use a product that's not shorter than the standard long-term care, because if we're talking about probabilities, 70% of people have a long-term care need, and about 80% only need it for less than 2 years. So buying a 3, a 5, 10, or a continual year policy is not I'm not saying it's not necessary. It is necessary for people who want to protect themselves against that kind of risk, but it's not the only kind of insurance that should be sold. So how does this work? Well, the short-term care policy is flexible, has a pool of money you draw down from. It restores after not being used for 365 days, and it's mobile. You can go wherever you need to be. And here are all the costs or all the costs that it covers that Medicare doesn't. It's a pretty long list. So one of the major things that people always think about is they can get it later. And as we probably will see at the end of this video or end of this slideshow, is that it's cheaper younger, and as you get older, it just gets more expensive. So you could be potentially getting coverage for at the same cost by purchasing it 5-10 years earlier, right? So it's to protect your retirement savings, reduce your out-of-pocket costs, make it easier for your family, reduce the risk of them hurting you or themselves, support your ability to receive care at home. So, Medicare says that 7 out of 10 of us will need in-home care or in a facility. Medicare and supplements don't pay for this kind of care, neither do Medicare Advantage companies. So it's time to start planning now, and make sure you talk about this with your clients because it's very important. So this should be a financial or a business decision, not an emotional decision. We can't will our way out of needing this kind of care. 7 out of 10 is very, very high. 70% chance of something happening is really high. And it does not save us money to wait to see if we can get approved. So we should, if they want it, just try. And it does not save money to wait. So this is the thing I was talking about. If someone who's age 50, they will pay $30,000 in total premium for the same policy. Someone 60 is actually paying $8,000 more, even though they started 10 years later. Someone who's 70 is paying $24,000 more, even though they started 20 years later. And someone who is age 80 is paying $30,000 more, even if they started a full 30 years after this person who started at age 50. So it really is something that we should talk about and at least put it into, put it into a proposal, just so that we can have, say, hey, we talked about this, and if this ever were to happen, and they're like, hey, I thought Medicare covers this, you can say, hey, no, Medicare doesn't cover this. Remember that conversation we had? So as an agent, as someone who cares for your clients, this is definitely something you should add. If you need help with this, please let me know. We'll be having trainings on this probably once a week now, because I believe it's something that we should be incorporating in our business. And it should be a way to add and attract more clients as well. So hope this helps. We'll see you in the next video, where we'll talk more about short-term care and how to properly, answer questions when it comes to the policy. So stay tuned for that.